Assalamualaikum. I am Dr. Samra and today we will discuss measles, chickenpox and rubella. In these three diseases, one thing is common, that is rash. So first we have to know what is rash and which type of rash we have in these type of diseases. There are two important type of rashes. Number one, maculopapular rash and vesicopapular rash. And these maculopapular rash consist of two things, macule and papule. Now, what is macule and what is papule? Macule is a non-palpable, circumscribed, flat area, and this is less than 1 centimeter. And papule is similar to macule, but it is palpable. It will be palpable and elevated area, but size will be the same like one less than 1 centimeter. And what is maculopapular? It is a rash made up of both macule and papule layers. Same like a purpura is defined as papular and macular non-blanching layers. Okay, and rest of the definitions are not, we will not discuss in this topic. As we previously described, what is maculopapular rash? It is made up of both flat and gray skin layers. They are small, usually red, and can merge together. There are different causes for maculopapular rash. We should know silent causes of this: measles, rubella, roseola infantum, parvovirus B19, Coxsackie virus, scarlet fever, Kawasaki disease, and infection mononucleosis caused by Epstein-Barr virus. Today we will just discuss most common, that is measles and rubella. Next, we will discuss vesicopapular rash, in which we will discuss chickenpox. In vesicopapular rash, there is a raised area, papilla, and vesicle mean it is a fruit-filled sac. Vesicle means is a fruit-filled sac or rash. Okay, the rash, and we will discuss chickenpox today. Now, this picture is showing running nose, measly rook, with running nose, conjunctivitis in eyes, maculopapular rash, and Koplik spot. These are the main silent and important feature of measles. Now, what is measles? Measles is a disease caused by virus, paramyxovirus, and its incubation period is 1 to 14 days. 1 to 14 days. After 1 to 14 days, child will be all right, or develop any complication if we will if we will left it as untreated. Now we already discussed silent feature of the measles. In measles, there is a 3 C's. Remember 3 C's: cough, coryza, and conjunctivitis. There will be cough, coryza, conjunctivitis along with nice lymphadenopathy, which is non-significant, and macular papular rash. When there is a when there is a eruption of fever, when there is eruption of rash, the patients will suffer from the high-grade fever. Next differential of macular rash is rubella. Rubella has three characteristic feature. There will be posterior cervical and post-occipital lymphadenopathy along with maculopapular rash, and there will be pharyngitis. And there in case of measles we have Koplik spot in mouth, or in case of rubella we have Farsheimer's spot in palate. If mother is suffering from rubella and baby is going to deliver, then there is a congenital rubella syndrome which is having microcephaly, PDA, and cataract. These are three characteristic features of rubella: posterior cervical lymphadenopathy, Farsheimer's rash, these are we will see on palate, and maculopapular rash. How it will be different from measles? Like have a look. In measles, we have three C's: cough, coryza, conjunctivitis, along with coplic spot on buccal mucosa. In case of rubella, general measles, we have four humor spots on soft palate. Okay. In both cases, fever will be occur, but in case of measles, fever is high grade, but in case of rubella, fever is low grade. And when rash appears, fever will, in case of measles, high grade. But in case of rubella, there is only 3-day fevers and 3-day rash. Rash began from the face and spread on the body in both cases, measles and rubella. But it is different. But it will be different from chickenpox. In case of chickenpox, rash started from the trunk and then spread peripherally. But in case of measles and rubella, rash started from the face and behind the nape area hairline and then spread on the body. And now we will discuss chickenpox. This is a picture showing chickenpox. Let's we have a look. There is a crusty lesions, fluid-free lesions, and there is exfoliation and scab formation. We have different stages of lesions in this picture. We have and this when there is a scab formation, patient have itching in case of chickenpox. Chickenpox is characterized by classical vascular lesions on an erythematous base that appear in crops. Crops mean we have different stages of vascular lesion on the same at the same time. We have vascular rash, we have crusted lesions, we have scab formation at the same time. And And this is the difference between chickenpox and measles. Chickenpox incubation period is same. All viral diseases have the same, almost same type of incubation, 1 to 14 days. Fever and fatigue, malaise, with body aches. These are the common symptoms along with rash. Rash is different. In case of measles, there is a maculopapular rash, and in case of chickenpox, there is a vesicular papular rash. What is the main differentiating point of measles and chickenpox? One is this: there is a vesicular papular, and in measles we have macular papular. In case of chickenpox, rash started from the body, trunk, and then spread periphery. Or in case of measles, we have a rash started from the face and then spread on the body. Another feature, there is a 3 C's in cough, coryza, and conjunctivitis in case of measles. And we have coplic spot in before rash is going to appear, that is on buccal mucosa, but there is no such a spot in case of chickenpox. Because what today lecture is about differential diagnosis, and we will discuss only the silent features of the differentiating point of these three diseases. In all viral diseases are diagnosed by viral throat swab and by PCRs and no by PCR. We can take the swab from the nose and throat because they are having common feature of cough, coryza, and pharyngitis. And in and CBC examination, what we will have lymphocytosis along with neutropenia. Viral treatment, viral disease have no specific treatment, but we will treat the signs symptoms of the patient by general management. We will give if we have antiviral we can give, but in generally we don't need any antiviral therapy for these type of infections. Antibiotic will be given in case of complication, and we will start supportive therapy like if we having pneumonia, we will give oxygen inhalation. If there is a dehydration due to loose motion, vomiting, we will give IV fluid. And these are the general sportive points in the management. Every viral patient which having disease like chickenpox, measles, and rubella, they should be isolated from the normal persons. They should be keep in isolation. They will given skin care. They should take bath daily. and they should take uh, nebulization, and they should mouth gargles and rinsing of the mouth again and again. In case of measles, there is a conjunctivitis. We should give eye care by protecting it from light and direct glare of light. In case of otitis media, will give the take care of ear. These are the because uh, measles causes otitis media. We should regularly examine the ear for any discharge and pus, and daily elimination is important. This can be accomplished by mild laxative or as prescribed by physician. Constipation should be avoided. In case of chickenpox, same management, but because scab formation is in chickenpox and exfoliation occur, and that causes itching of the patient. So for avoiding itching and pruritus, we should use anti-allergic drugs, and we should use any emollient like calamine lotion and oatmeal baths. And for fever, we can give NSAIDs, anti-inflammatory drugs, and like Brufen, and there is no role of any antiviral therapy. How to prevent these chickenpox and measles? Uh, and chickenpox and measles by vaccination. In our EPI schedule, these three diseases are targeted. We have anti-measles vaccine in at the age of 9 months as a single dose, and booster will be given at 15 months of age, and then at 4 to 5 years of age. Rubella vaccination is not available separately. It occurs in combination in with measles and rubella, and it is given, first dose is given at 15 month of age, and second dose at 11 to 12 years. In Pakistan, it will give at 4 to 5 years of age. For chickenpox, we have Verivax. We also have measles mumps MMRV in the form of measles mumps rubella V, which will be given at 12 to 15 months of age. But in Pakistan, MMRV is not available. We will give separately Verivac at the age of 12 to 12 to 15 months of age, and second dose is given at 4 to 5 year of age. 4 to 5 year of age. If a patient is unvaccinated and and age is gone, and is now 7 to 8 years of age, should we give a varicella vaccination? Yes, we can give varicella vaccination. We can give varicella vaccination two doses, 3 months apart. Now this is your test, what you have learned from this lecture. Read these questions and answer in comments, and we should consider it as your attendant. There are three questions. First question is, a 4-year-old unvaccinated male child coming to you in OPD with complaint of fever for 3 days, associated with cough, runny nose, and red eyes. Today he developed a reddish discoloration of face without itching, and fever is increased after rash. Now read it carefully and and try to give their answer in comment, and it will be considered as your attendance. Next question is, identify this rash and give its diagnosis. There is a clue in this picture. Intelligent student can knew it. What is the clue in this picture? Thanks for your listening.